Hi, I'm Amit Vats. I'm a consultant orthopedic surgeon working in Surrey and London area. My NHS practice is in Ashford and St. Peter's Hospital. Um, Apart from being an orthopedic surgeon, I am also the Chief of Patient Safety for my NHS hospital and the Deputy Medical Director. From the time that I can remember being a child, um, I recall always wanting to be a doctor. I think it all came from the time when, as a child, I was quite unwell and in a hospital, and probably that has had an impact where I saw doctors, young doctors, older doctors who tended to me, and I think I somehow assimilated with that environment, and I think that has had an impact. I do quite enjoy the interaction that one has with patients, the staff, and I also gain a lot of satisfaction from being able to help people. I wanted to be a doctor, but as I took up medicine and went through my medical and surgical training, I had an instant liking towards surgical specialties. It was almost like a affinity that fish would have to water. I did enjoy the theatre environment, the camaraderie, the teamwork that's involved, and the ability to be able to work in a stressful environment on acutely unwell patients or planned procedures, and be able to offer somebody a quality of life, or mending a fracture, for instance, and the instant feedback and satisfaction that one gets with it. So orthopedics I particularly enjoy because I am very hands-on. I do enjoy DIY. I do like technology, and I like medicine. And I think orthopedics provides that perfect combination of all these interests that I have. So for me, it is not just work, it's passion. This is what I enjoy. Satisfaction. It is about being able to offer somebody a quality of life that they have lost over time. For instance, somebody coming in their 50s, 60s, or 70s, where the mobility has gradually gone down, the quality of life has gone down. They can't do things with their partners and family because of hip pain or knee pain, and to be able to offer them a quality of life with a surgery that an orthopedic surgeon can provide. That is really satisfying. So that's on the elective side. I do also specialize in limb reconstruction, and that is more geared towards acute pathology, where somebody might have a very nasty fracture where the limb is destroyed, and then to be able to provide a repair to that limb and salvage that limb. That's really satisfying. So I do enjoy a perfect balance of the planned elective surgery and also share of trauma, but trauma is more towards the NHS practice, and it is elective side that is, well, of course, part of the NHS practice, but also my private work. So I'll start with what my patients value most from me. From the feedback that I have received talking to patients that I have treated over years, I think they do value what I offer in terms of the human touch, to be able to listen, to be able to identify what their needs are, to be able to have a discussion with them openly and frankly, what I can help them with and what I can't help them with. And to give every patient my very best. Sometimes I may be able to offer treatments or management plans. Sometimes I may not be able to offer, but what I can offer is my dedication and my attention towards their care. What I value the most from my patients is a determination to get better. Patients who are motivated, patients who want to progress and improve their life, that I value the most, because that makes my job so much easier. I don't think I have a mantra or a catchphrase for work, because it's about individual care. And while I do believe in standardization of care, I do believe in maintaining processes that are reputable and that are ingrained in the core concept of patient safety. I do have discussions which are relating to patients' expectations and the outcomes that they are wanting from my management plan. So I don't have a mantra, but what I do say is that especially after any procedure, is to have the goodwill and the determination and be motivated to improve their quality of life. Because with any orthopedic pathology or with surgery, a big part of effort is from the patient. The determination to get better and to do the exercises and be motivated.